Thank you, Encik Azmarul, for the wonderful feedback. Okay, thank you to all participants who are involved in the morning session talk. Okay, now we will have a special presentation from the Director of Unilangit Academy, Sendirian Berhad, Professor Dr. Hajah Rogayah A. Raza.
Assalamualaikum warahmatullahi wabarakatuh. Everyone can hear me? Indeed, I'm very blessed. Thank you for the invite, and especially for the first research conference by speech therapists. I'm wearing two hats. One hat is the academician that I am, which is I am still now at Sagi University, and also as the director of Unilangit. So today I'm wearing the Unilangit hat. Okay, so I'm going to share my presentation. This is a presentation on evidence-based practice and MPLAT via MPLAT. Okay, if you cannot hear the video, please tell me. Yeah. Okay, so today's talk is on evidence-based practice via MPLAT. I'm going to talk a little bit about definition of evidence-based practice, including evidence-based practice by ASHA, and then some information about MPLAT, and also some testimony from SLT users and one interventionist. So evidence-based practice is the application of scientific research, clinical experience, and patient needs to provide effective care and optimize patient outcomes. It is used to influence decision-making and provide optimal care. So the evidence-based practice in the medical field is the conscientious, explicit, and judicious use of the current best practice about the care of individual patients, the practice of evidence based on the best research practice, integrating individual clinical expertise with the best available external clinical evidence from the systematic research. So why is it important? First of all, it's important because it is based in science and research and validated by extensive scientific studies and research. Number two, it allows for continual evolution of treatment. Treatments based on EBP evolve and improved based on newly discovered evidence. So it's continually updating itself. Yeah? It also addresses patients' needs and preferences. It allows us to customize treatment plans to the principal healthcare needs of individuals and promote self-advocacy and empowerment within patients. It also ensures that patients receive optimal treatment, best possible treatment for their unique situation and healthcare needs. So in a nutshell, evidence-based practice enables evidence-informed standardized protocols, not cookbook healthcare. It affords transparent pathways to improving diagnosis, treatment, and health outcomes. EBP in speech therapy by ASHA, they look at it from the clinical expertise. This is the knowledge, judgment, and critical reasoning acquired through SLT training and professional experience. Evidence is available from external, from the scientific literature, and also internal. Internal is the data and observation that you collect from your patient. And then we have the client perspective or caregiver perspective, the unique set of personal and cultural circumstances, values, priorities, and expectations identified by your client and their caregivers. When all these three components are considered together, clinicians SLT can make informed evidence-based decision and provide high quality services reflecting the interests, values, and needs of the clients. Okay, so now I am transitioning to MPLAT. For those who are not familiar with MPLAT, the Malay Preschool Language Assessment Tool, alat ujian bahasa kanak-kanak prasekolah Melayu. So MPLAT has two versions, which is the diagnostic version and the screening version. And it has 6 subtests. It has a receptive component, the picture vocabulary, and grammatical understanding. The expressive component consists of the sentence repetition, the referential meaning, and the relational meaning. And the early literacy skill because of the preschool. So as you can see, very roughly, that MPLAT screening is a quarter of the MPLAT diagnostic. Yeah, so we will see later that it is met for different reasons. So I'm going to play to you a short 3-minute video about MPLAT.
Assalamualaikum warahmatullahi taala wabarakatuh. Hari ini kita ingin memperkenalkan alat ujian bahasa kanak-kanak prasekolah Melayu. Alat ini ada alat yang piawai yang telah diuji ke atas 509 orang kanak-kanak di Malaysia, dan ia menguji keupayaan bahasa dan literasi awal bagi kanak-kanak yang berumur di antara 4 hingga 6 tahun 11 bulan, iaitu prasekolah. Set ini terdiri daripada set saringan dan set diagnostik. Apa bezanya? Saringan ini adalah ujian yang pantas, 10 ke 15 minit saja dijalankan, sementara diagnostik pula adalah ujian yang agak mendalam, di mana kita mengambil dalam masa 30 hingga 40 minit. Jadi yang saringan ini adalah boleh digunakan oleh guru, jururawat, ibu bapa dan sebagainya, sementara diagnostik pula hanya untuk terapis pertuturan bahasa dan pengkaji. Alat saringan mempunyai 6 sub ujian, ya. Terdiri daripada menguji bahasa reseptif, pemahaman, bahasa ekspresif, penghasilan, dan juga awal literasi. Menggunakan markah mentah, di mana kita setelah habis menguji, kita akan menjumlahkan skor, dan skor totalnya adalah 55. Dan kalau kita lihat di sini ada taburan markah, dan bagi setiap umur tu, sela umur itu ada markah yang sudah dihitamkan, dan markah itu dan markah di bawahnya adalah markah yang gagal. Jadi kalau kanak-kanak itu mendapat markah yang dihitamkan atau lebih rendah daripada itu, dia adalah gagal, sementara yang di atas semua adalah lulus. Jadi saringan ini sangat cepat. Sementara itu diagnostik pula sub ujiannya sama, ya, ada 6 sub ujian, tetapi jumlah markahnya 170. Jadi agak banyak itemnya, dan markah yang kita gunakan adalah markah mentah. Markah mentah boleh ditukarkan kepada markah standard sebab kita menguji merentas umur dan kemahiran bahasa, dan juga menggunakan persentil. Kita dapat membandingkan keupayaan budak yang kita uji dengan budak-budak lain dalam umur itu. Selain daripada itu, kita ada plot chart di mana skor yang standard itu 20 adalah skor yang purata, dan kita dapat melihat sama ada kanak-kanak yang diuji itu berada di atas atau di bawah purata itu. Jadi alat ini adalah alat yang telah diuji ke atas 509 kanak-kanak Melayu di Malaysia, di kawasan bandar dan di kawasan rural. Dan ia merupakan satu ujian yang amat penting untuk kita menentukan sama ada kanak-kanak itu berisiko atau tidak pencegahan bahasa sebelum kita melakukan intervensi yang sewajarnya. Terima kasih. Assalamualaikum.
Okay. The futures of MPLAT, basically, it is the first standardized language assessment tool in Malaysia, easy to administer, fast, and it can test the language and the early literacy skills. You can compare the performance of the kid that you are testing to the kids of his age group. It is produced out of rigorous research for 11 years, and it can bring about, when you use the screening, it can bring about early intervention, early identification, and also early intervention. So it is contained in a box. It has the manual, and it has a flip chart picture stimuli book, and then it has a scoring sheet. It is used by preschool children, but if you have children between 7 to 12 who are at risk or have language disorders, you can use MPLAT because the language age will fall back into the preschool. Okay. So basically, these are the authors of MPLAT: myself, Professor Emeritus Dr. Charles Madison from Washington State University. He's retired now, and Mr. Muhammad Azmarul Aziz from Cheras Rehab. In terms of the packaging that we have for MPLAT, we offer diagnostic, we offer screening, but you can get both set, diagnostic and screening, in a combo. And recently we introduced a package where you get the MPLAT with the training and 1-year consultation. I think most language tools are not provided with training. Yeah? So now we have offered that. In terms of cost, if you compare SELF, PLS5, the new Raynell developmental language skills, which are about the same age for population with MPLAT, we are still very competitive in terms of that, and while still maintaining the quality. Yeah? All right, so we did a survey in 2018 on 53 SLPs on the possibility of use of MPLAT. It showed that the questions are positively received. Looking at the percentages, and most of the responses were around 80s and 90s, except for, and they obtained significant values, except for question 6, which is the duration of the administration, and question 8, 72.5, based on the sufficiency in describing language abilities. So you can see this, basically, this is the questionnaire. So we actually, I can't see the, okay. So we actually divide the respondents into less than 5 years working experience and more than 5 years working experience. And if you can see, the responses are higher for the more than 5 years and lower for the less than 5 years. In terms of the lower percentage was number 6, whether the MPLAT can be administered between 30 to diagnostic can be administered to 30 to 45 minutes. Do you think the time duration is practical for the assessment? So for the less than 5 years, 42.4, and more than 5 years, 49%. So, and then the other one is the 6 subtests in MPLAT are sufficient to describe the language ability of a child. So that's these are the, of course, also higher for the more than 5 years. But generally, all are significant, having significant values. Okay, so I'm gonna present to you some video testimony. Yeah.
Assalamualaikum, saya Sherry, speech therapist daripada Hospital Chancellor Tuanku Mukhriz. Pengalaman saya menggunakan MPLAT ini sangat membantu saya dalam menilai tahap perkembangan bahasa kanak-kanak. Jadi MPLAT ini memang terdiri daripada 2 komponen utama dari segi perkembangan bahasa, iaitu perkembangan ekspresif dan juga perkembangan kefahaman bahasa. MPLAT ini adalah mengikut culture dan silibus akademik kita di Malaysia. Jadi ayat-ayat yang digunakan di dalam MPLAT ini juga adalah mengikut bersesuaian umur kanak-kanak itu sendiri. Penggunaan gambar yang menarik dan berwarna dapat menarik minat dan juga fokus kanak-kanak sepanjang proses penilaian ini. Jadi MPLAT ini juga mempunyai sistem pemarkahan yang boleh membantu terapis itu sendiri untuk mengenal pasti apa matlamat dan di mana untuk kita bermula dalam merancang intervensi bahasa kanak-kanak itu sendiri. Jadi saya sangat mengesyorkan untuk semua speech therapy di Malaysia boleh mula menggunakan MPLAT bagi menilai perkembangan bahasa kanak-kanak.
Puan Ifa Rashid.
Hi, hello, my name is Ifa Mazlan and I'm a speech and language therapist working with younger children and school-age children. So most of the kids that I see in my caseload are Malay speakers as well as Malay and English speakers, bilingual. And I'll be using the Malay preschool language assessment tool, screening and diagnostic in order to identify children who have difficulties or disordered in terms of their speech and language development. And I've been using the MPLAT for my screening to identify school-aged children who have difficulties in the language area as it impacts their academic performances. So these children usually comes to me because of the teachers or parent report of poor academic achievement in their English and Malay subject, where most of them are still unable to read at the age of 8 or 9 years old. So basically, I've been using the MPLAT because it is the closest that I can get to the typical Malay population, since we don't have any school-age children standardized assessment for school-age children just yet. So with the MPLAT, I can have a rough idea, especially for school-age children, about their vocabulary, their grammatical understanding, and their working memory in terms of recalling sentences, and also whether they are able to associate meanings and identify meanings to the words given. So as well as it also has pre-literacy component, which is crucial for these children who have difficulties in reading. So to be able to identify what's the problem is in their core language is important. So hence the MPLAT is quite useful in identifying this component at the screening base. And then of course, in order to get more information, we can then MPLAT diagnostic tools to identify further which area of the language components they have difficulties with. So then from there, we can then refer for further evaluation for these children, as well as we know what goals to target in terms of intervention and whether they need speech and language therapy services or they just need more reinforcement, enhancement in reading and literacy, as well as academic intervention compared to speech and language therapy. So so it has been convenient experience using the MPLAT. I think I've used a lot of MPLAT screening and most of my school age screening and preschool screening for children with suspected language disorder or delay. So yeah, thank you.
I've been using the MPLAT ever since varsity and now in the hospital. So it is a very comprehensive standardized tool. Administration is easy to use once you get the hang of it, and the pictures, they're professionally done, so it helps with the overall testing procedure. So I like using the MPLAT. It gives a baseline of the child's language, and then if I need anything else to further analyze, I'll just do it on top of it. So for example, I might add on some informal measures or even a language sample if I have the time. So what I usually do is I use the MPLAT to get the baseline, and then I top it up with some other informal measures to get more samples. So the items in the test are quite insightful actually. Most of the vocabulary and sentences are functional. Overall, I'm really grateful, we're really grateful at the hospital to Prof. Rogaya and also J. Asmaro and the team for developing this tool, especially for our population. Thank you.
My name is Dr. Dorizan, Director of Benitos. I'm a clinical linguist and Director of Center. We have been using MPLAT, Malaysia Preschool Assessment Tool, for a good 2.5 years, especially the saringan, ujian saringan, and also later on the full version of the test. We have found it quite helpful. Myself, our speech therapist, as a way to gauge Malay speakers, children, in terms of their language capacity. We also use it for 7-year-olds, 8-year-olds, and it helped us to see even if the child has some language or is able to carry on conversation, but we can also analyze and see what's the reason that impedes their understanding. For example, their listening capacity with the sentence repetition and looking at their vocabularies and understanding of meaning. This tool is also valuable in also screening for early literacy, which I feel that a lot of our kids which started with speech issues sometimes can correlate with learning difficulties. So I really highly recommend the use of this for all interventionists, the speech therapists, the teachers, to use this.
Okay, so for the goodness of it, MPLAT, as you can see, fulfills all the criteria of a good standardized test. And so this is a good testimony also for MPLAT. We also do MPLAT training at our center for speech therapists and also for developmental pediatrician and psychologists. We also do on-site training. This is training that we did for Pemata Kunia or Genius, Pemata Genius, or Genius Kunia, to their stakeholders, so psychologists, pediatrician, and also interventionists. This is our website. You can www.unilangit.com. You can come and visit and see what we do. And I can be contacted at this email or my Gmail and my ORCID if you want to know what I'm doing. I'm also available on ResearchGate if you want to know more about the research that I'm involved in. I think that's it. Thank you so much.